This month's topic is misconceptions about diabetes, both preventing and managing it. Let's first talk about what is diabetes. It's a group of diseases where the body is not able to make and or use insulin properly, resulting in not being able to use glucose very well either. Now let's define some of those terms. Insulin is a hormone made by the body in our pancreas. It helps glucose, or blood sugar, enter the body's cells so that it can be used for energy or stored for future use. Glucose is a type of carbohydrate or sugar that has been broken down into a simple form so that the body can then use it for energy. We get glucose from eating and drinking foods that contain carbohydrates. The human body can also create glucose from other nutrients such as protein and fat if needed. This slide shows what happens when glucose metabolism is occurring normally. Here we have a cell. The insulin acts like a key and goes into the insulin receptor part of the cell, as you can see here. Then that unlocks the glucose channel, which allows the glucose to enter into the cell, and then the cell can use the glucose for energy. What can happen with diabetes is that the body may stop making insulin, or the body may still make insulin, but that insulin doesn't work as well as it used to. So the body may need to keep making more and more to try to open up the glucose channels, and this is also known as insulin resistance. So the glucose cannot get into the cell, and the cells cannot use it for energy properly. Let's next take a look at the first misconception about diabetes. That only children get type 1 diabetes, previously known as juvenile onset, and that only adults get type 2 diabetes, previously known as adult onset. This is not true. There are various types of diabetes, the most common types being type 1 diabetes, LADA or latent autoimmune diabetes in adults, type 2 diabetes, gestational, which is diabetes during pregnancy, and then there are also less common types. Type 1 diabetes is an autoimmune disease, meaning that there is some type of trigger and the body's immune system starts attacking the cells in the pancreas that make insulin. Most commonly, this occurs during childhood or adolescence, but it can occur at any age. At this time, someone that has type 1 diabetes will need to either inject insulin or use an insulin pump to administer insulin into the body. LADA, or latent autoimmune diabetes in adults, is being diagnosed more and more. It's a slow progressing form of autoimmune diabetes. Type 2 diabetes, which accounts for about 90 to 95% of the diabetes here in the United States, is a metabolic disease, possibly also an autoimmune disease, where the pancreas produces very little insulin and or the body does not respond appropriately to that insulin. That's, again, the condition called insulin resistance. This type of diabetes is a progressive condition, meaning that it can get worse over time. When someone has prediabetes, they have pre-type 2 diabetes. Generally, type 2 diabetes occurs in middle-aged adults, most frequently after the age of 45. However, healthcare providers are diagnosing more and more children and adolescents with type 2 diabetes. These pictures show us the difference of what's happening in the body between type 1 diabetes and type 2 diabetes. So in both pictures, you can see that when the person eats something, the food comes into the stomach and is broken down into glucose. This is represented as the purplish blue little circles here. Then, when it's in its simple form, the glucose starts to enter the bloodstream, which is shown here. In type 2 diabetes, the pancreas is still making some insulin. That insulin also enters into the bloodstream. However, with type 2 diabetes, the glucose can't get into the cells of the body and it starts to build up inside of the blood vessels, resulting in high blood sugar. In type 1 diabetes, the body is making very little to no insulin. So you can see here there's just a little bit of insulin inside the bloodstream. Therefore, this also causes a buildup of glucose inside the bloodstream. The last type of diabetes that is seen fairly often is called gestational diabetes. This is diabetes that occurs during pregnancy. All women that do not already have diabetes are tested for gestational diabetes during their pregnancy. It typically occurs due to hormonal changes and a woman's body needing to make extra insulin to help keep her blood sugar within the normal range. Sometimes her body needs to make 3 times the normal amount of insulin. Rates in the U.S. are estimated to be between 5 to 10% of women may develop gestational diabetes during pregnancy. The next misconception about diabetes is that I don't have a family history of diabetes, so I don't need to worry about it. Now let's take a look at the risk factors for developing type 1 diabetes. These are non-modifiable, meaning that we can't change these risk factors. Having a family history. If we have a relative that has type 1 diabetes, it can also mean that we have an increased genetic risk of developing type 1 diabetes. Some diseases of the pancreas can slow the organ's ability to make insulin, resulting in type 1 diabetes. And then there are also some infections and illnesses which can damage the pancreas, also causing type 1 diabetes. Here are the risk factors that can increase someone's chance of developing type 2 diabetes. The first ones are also non-modifiable, meaning that we can't change these. If we have a family history, that does increase our risk for developing type 2 diabetes. Certain ethnic backgrounds, being of African American, Asian American, Latino or Hispanic American, Native American, or Pacific Islander descent, can increase the likelihood of developing type 2 diabetes. As we mentioned earlier, as we age, it increases our risk. However, we are seeing type 2 diabetes diagnosed younger and younger. And then for women, if they ever had gestational diabetes, it may also place them at a higher risk for developing type 2 diabetes later in life. Now, the good news for type 2 diabetes, there are some things that are modifiable, meaning that we can have an impact on these. Being overweight or obesity. Being overweight puts us at a higher risk of developing diabetes. Losing just 5 to 7% of our current body weight can cut our risk of developing diabetes in half, and your risk decreases even more as you lose weight. So, for example, if someone weighed 200 pounds, that 5 to 7% would be losing between 10 to 14 pounds, could cut their risk of developing diabetes in half. The next risk factor that we have an impact on is how much we move. Our physical activity is one of the greatest modifiable risk factors for developing prediabetes and type 2 diabetes. Achieving at least 150 minutes per week of moderate intensity aerobic physical activity, which is the equivalent of a brisk walk, or 75 minutes per week of vigorous intensity aerobic physical activity, or a combination of the two, along with muscle strengthening activities at least 2 days per week, is very important for our overall cardiovascular health as well as preventing type 2 diabetes. Another risk factor that we do have an impact on is our blood pressure. High blood pressure or hypertension, in addition to causing damage to the cardiovascular system, if left untreated, has also been linked to the development of type 2 diabetes. Also, our cholesterol or lipid levels. Having a low HDL or good type of cholesterol and or a high level of triglycerides can increase the risk for type 2 diabetes and cardiovascular disease. A healthy eating plan, regular aerobic physical activity, and a healthy weight can help improve abnormal lipid levels. Sometimes medications are also necessary. The next misconceptions about diabetes that we're going to talk about are that eating too much sugar causes diabetes, or that if you have diabetes, you cannot eat sugar, sweets, or desserts. Oftentimes that has people ask, well, how much sugar should I eat? There's no recommended amount of daily added sugar. That means that we don't need it. We typically get enough carbohydrates from the foods that we eat that is naturally in those carbohydrates. That said, most people in the U.S. would benefit from eating less sugar, no matter if they have diabetes or not. The American Heart Association has come up with some recommendations to stay at or below. This is 6 teaspoons of added sugar a day for women, 9 teaspoons of added sugar a day or less for men. And some people will say, well, why do men get more? They tend to have higher metabolisms and are able to break down that sugar a little bit better. But again, it is best to try to limit the added sugars as much as possible. Sweets are no more off limits to people with diabetes than they are to people without diabetes. The key here is to have a small portion and to save them for special occasions so we can focus our meals on the more healthful foods. I like to think of like an 80-20 plan. 80% of the time eat foods that are quite nutritious, and then 20% of the time give yourself a little wiggle room, some leniency there. The next misconceptions about diabetes is that the diet is strict. You have to eat certain foods if you have diabetes, and you have to eat different from people that don't have diabetes. A healthy meal plan for someone that has diabetes is generally the same as a healthy eating plan for anyone. Low in saturated and trans fat, moderate in salt and sugar, with meals based on lean proteins, non-starchy vegetables, whole grains, healthy fats, and fruit. Diabetic foods that are sold at grocery stores generally offer no special benefit. Most of them still raise our blood glucose levels because they do contain carbohydrates. They're usually more expensive, and they can also have a laxative effect if they contain sugar alcohols. I want to take a second here and explain that sugar alcohols are a type of carbohydrate. However, they are not sugar. So you may see something labeled as sugar-free that actually has carbohydrates. So I always encourage people when they're looking at a nutrition facts label to look at the total carbohydrate number and not just the sugars. The next misconception is that I can tell what my blood sugar is by how I feel. Sometimes you may have symptoms of high or low blood sugar, sometimes you may not. The body can adapt to high or low blood sugar over time. This is one reason why some people take a while to become diagnosed with diabetes, even though they've had it for some time. Their body gets used to having high blood sugar. Low blood sugar can be extremely dangerous because it may happen very quickly, and the person may get into a condition where they are not able to help themselves treat the low blood sugar, and or they may have an injury or an accident. Over time, a person's body can also get used to low blood sugar levels, and they may become less symptomatic. These are the symptoms of high blood sugar if left treated over time. People tend to say that they are tired, they are urinating often, they're also very thirsty. This is the body's way of trying to flush out the extra blood sugar. They may have lost weight without really trying. You may notice that you have wounds, or cuts, or infections that don't heal. Oftentimes, sexual problems are caused by high blood sugar. Blurry vision, always hungry because the sugar is not able to get into the cells. Some people notice numbness or tingling in their hands and feet. So definitely, if you have any of these symptoms, we recommend that you talk to your primary care provider as soon as possible. Some people will say that taking insulin means that my diabetes has gotten bad. Or, I only take pills, so my diabetes isn't really that bad or that serious. There are many different ways to medically manage and treat diabetes. Different medications work on different parts of the body. As we continuously learn more about diabetes, new medications are being created. Some medications are able to be taken in a pill form, some need to be administered via injection. This does not mean that one is better or worse than the other. Working with your provider and being honest about your lifestyle, your goals, and what you are willing to do can help create the best plan for you. As mentioned previously, type 2 diabetes is a progressive disease, and oftentimes medical management will at some point need to be adjusted to treat the person. Also, as previously stated, lifestyle can play a significant role in slowing down the progression of diabetes. Some people may say that diabetes is not that serious. Uncontrolled diabetes can be very serious. Adults with diabetes are at a 200 to 400% increased risk for a heart attack or stroke than those without diabetes. Uncontrolled diabetes is the leading cause of kidney failure, which may eventually require dialysis and/or a kidney transplant. Diabetic retinopathy is the leading cause of blindness among non-elderly people. Infections caused by unmanaged diabetes are the leading cause of non-traumatic amputations of the lower extremities. Diabetes causes more deaths a year than breast cancer and AIDS combined. And diabetes is considered one of 7 controllable risk factors for cardiovascular disease. Now, I don't say all of these things to scare you, but I do want the point to be taken that diabetes can be very serious. The good news is that good diabetes control can reduce your risk factors for a lot of these diabetic complications. Diabetes can be managed, keeping our blood sugar levels as close to normal range as possible with a combination of medication, diet, and exercise can greatly reduce the risk for these outcomes. As a bonus, an effective diabetes management lifestyle reduces the risks for heart disease as well. The last misconception is that cinnamon, chromium, and other over-the-counter supplements are a good way to manage blood sugar. Research is mixed as to the efficacy of these alternative medicines. There is some question about safety. Some studies have suggested possible organ damage. These may also interfere with other medications that you're taking. Dietary supplements are not as closely regulated as foods or medications in the U.S. Some are quite costly with little to no proven benefits. Overall, it's probably safe to consume some of these as food, but be wary of consuming in mega doses or very large quantities. These are some of the most commonly asked about supplements. Apple cider vinegar, it is thought that it may help improve insulin sensitivity. However, it may irritate a person's throat if they drink it often or in large amounts. It may interact with certain supplements or drugs, including diuretics and insulin. It may contribute to lower potassium levels. The studies have not shown it's effective for weight loss, as it is sometimes believed. Chromium may help insulin work better, is the theory. However, it also may cause liver and/or kidney problems, can cause mood disturbances. It may actually cause low blood sugar or hypoglycemia. It could interfere with other medications such as antacids, beta blockers, and NSAIDs. Taking chromium in a supplement form has not been shown to help improve blood sugar values, but it may be beneficial to get an adequate amount from food, such as whole grains, broccoli, green beans, mushrooms, and other produce. The last one that I get questions about is cinnamon. It's thought that it can increase insulin sensitivity and action. It could cause bleeding or liver problems in prolonged use of large amounts. This is most likely only an issue if someone is taking it as a supplement. For most people, it's probably okay to eat cinnamon as a food and add it to some of your favorite dishes. So if you're wondering, do I have prediabetes? There has been a campaign here in the U.S. to help people figure out their risk factors, you can go to this website, doihaveprediabetes.org, and take a short quiz that will help you figure out if you're at risk for developing prediabetes. Studies have shown that most people diagnosed with prediabetes will develop type 2 diabetes within 10 years if they don't change their lifestyle. But like we've talked about quite a bit in this presentation, that lifestyle does play a huge role, and there are things that we can change in order to help prevent developing type 2 diabetes. Some other really incredible statistics here in the United States: 86 million Americans, more than 1 out of every 3 adults, have prediabetes. 9 out of 10, or 90% of people with prediabetes, do not know that they have it. So it's very important to get your blood sugar checked regularly with your doctor. If you have prediabetes, losing weight, like we said, by 5 to 7% of your current body weight can cut your risk in half of developing type 2 diabetes. In case you're wondering what the tests are for diabetes, there are a couple of tests that are done most often. One is an A1C, which is a hemoglobin A1C. It's a test that measures what the average blood sugars have been over the past 3 months. Normal is less than 5.7. Prediabetes is 5.7 to 6.4, and diabetes is 6.5 or higher. Oftentimes, just having one test that falls into the diabetes range, your doctor will not diagnose you with diabetes unless it's significantly high. They may want you to work on some lifestyle factors and then get your blood sugar tested again. The A1C, like I mentioned, is an average over the past 3 months. It's kind of like a report card. So you can't eat really healthy for a few days prior to this test, because it will take an average over the past few months. The next test that's done pretty commonly is a fasting plasma glucose. So this is where they check your blood sugar at the lab after you have not eaten for 8 or more hours. The goal is to have that fasting plasma glucose less than 100. 100 to 125 is considered the prediabetes range, and 126 or higher may put you into the diabetes range. Similarly, you will probably not get diagnosed with diabetes if you just have this test high one time, but if it's confirmed with a second test, you may be diagnosed with diabetes. Less common, but sometimes also done, is an oral glucose tolerance test, or an OGTT. This is where you go to the lab fasting, have your blood sugar checked, then you drink a sweet drink that contains quite a bit of sugar, and they test your blood sugar 2 hours later. The goal is to have that less than 140. If it's between 140 up to 199, that may mean prediabetes. If it's 200 or higher, that may mean diabetes. So again, it's always a good idea to have regular appointments and regular lab work as recommended by your primary care provider. Hopefully, this clears up some of the misconceptions and answers some of the questions you may have had about diabetes.